Today I want to talk about one of the most requested procedures in facial rejuvenation, the mini facelift. And the reason it's so popular is because of a lot of people don't feel ready for a full facelift, but they're definitely noticing changes in the lower face that they can't ignore anymore. Patients will come in and say, I feel like I'm starting to look heavier here, and they point to the jawline. Or they'll say, my face looks fine from the front, but in the photos I see these jowls, or I don't look like myself anymore, and I want something subtle. That's exactly the kind of patient who may be a great candidate for a mini facelift. So let's start with what a mini facelift is designed to do. A mini facelift is a facial rejuvenation procedure that focuses primarily on the face, the lower face, especially the jawline and early jowling. It's intended for patients who are experiencing mild to moderate laxity, but not advanced aging changes. In other words, it's best when the aging is just starting to show and you want to restore definition before things become more severe. Now, one of the reasons the mini facelift gets so much attention is because of the words mini and smaller incisions. People hear that and think it means it's an easy procedure with no downtime and dramatic results. And I want to be very honest, a mini facelift is still surgery. It's still a real procedure. You still need time to heal. But when it's done on the right candidate, the improvement can be incredibly satisfying because it looks natural and it targets the exact area most patients are bothered by, those early jowls and loss of jawline definition. Let's talk about why the jawline changes in the first place. As we age, the tissues in the face gradually descend. The skin loses elasticity, the deeper support structure loosens over time, and the area that often shows first is the lower face. You may still have good volume in the cheeks and your eyes may look fine, but you start to see that the jawline is not as crisp. The corners of the mouth may look slightly downward or downturned. The lower cheeks can look heavier. That's the beginning of jowling. A mini facelift is designed to correct that by tightening and repositioning the tissues of the lower face. The goal is to restore a cleaner jawline and a more youthful contour. Now here's a very important point. A mini facelift should not be just pulling the skin. The best, most natural mini facelift results come from addressing deeper layers, not simply tightening the surface. Skin-only tightening can lead to results that don't last as long and can sometimes look unnatural. A properly performed mini facelift is about restoring structure, then redraping the skin smoothly so there's minimal tension. That's how we get a refreshed look without a pulled look. So who is the ideal candidate for a mini facelift? Typically, it's someone who has mild to moderate jowling, early loss of jawline definition, good skin quality overall, minimal neck laxity or only mild neck changes, a desire for a subtle natural improvement. Mini facelifts are often popular for patients in their 40s and 50s, but age isn't the real deciding factor. Your anatomy is. Some people age earlier, some people have stronger genetics and age later. So it's not about a number, it's about what your face is doing. Now, who is the best candidate? If you have significant neck laxity, heavy banding, or a lot of loose skin under the chin, a mini facelift may not be enough. You may need a full facelift or a neck lift to get the results you want. And that's important because one of the biggest disappointments happens when someone chooses a mini facelift because it sounds easier, but they actually needed more correction. They go through surgery and recovery and they feel like it really didn't change enough. So the goal is to match the procedure to the problem. Let's talk about what results look like. A great mini facelift should look like you, just refreshed. Your jawline should look sharper, the jowls should be reduced, the lower face should look tighter and more youthful, and people should not look at you and think you had surgery. They should think you look rested, healthier, and more confident. Now let's talk about recovery because that's part of the decision making. After a mini facelift, you can expect swelling and bruising. The first week is usually the most noticeable. Many patients feel comfortable being seen socially within about 2 weeks, sometimes sooner depending on healing and makeup. But the result continues to improve over time as swelling resolves and the tissues settle into their final position. And the other thing I tell patients is that a mini facelift can be an excellent option if you want to get ahead of aging changes early. It can restore definition before jowling becomes more advanced, and because the change is more subtle, it often looks extremely natural. So here's the takeaway. A mini facelift is designed for early jowling and lower face laxity. It uses smaller incisions and can have a shorter recovery than a full facelift, but it still delivers a meaningful improvement when it matches your anatomy. It's not about changing your face, it's about restoring your jawline and helping you look like a refreshed version of yourself. If you're noticing early jowls and you're wondering if a mini facelift might be right for you, the best next step is a consultation. We'll evaluate your face and neck, talk about your goals, recommend the safest and most natural plan to get you the result you're looking for. So call us at 518-583-4019 and go to SaratogaSpringsPlasticSurgery.com. Thank you.